Hi, everyone, and welcome. We're so glad you're here. On behalf of the entire Fullscript team, thank you for carving out time to join us today. Whether you're tuning in between patient visits or setting aside space to grow, we know your time is valuable. And we've designed this event to make every minute count. You can expect content that's impactful, relevant, and immediately useful in your clinical world. I'm Dr. Kate Kresge, Director of Content and Provider Engagement here at Fullscript. My team is focused on equipping you with the kinds of tools and education that don't just inform, they empower. Whether you're running a solo practice or leading a clinical innovation team inside a larger system, our goal is to support you in delivering care that's more effective, more efficient, and more aligned with your values. Fullscript Forward is built for providers who believe in better. Better systems, better outcomes, better ways of supporting the people we serve. Today, you'll hear from some of the most insightful and experienced voices in healthcare, people who live what they teach and who bring practical, grounded wisdom to every conversation. Whichever session you attend, I know you'll walk away with insights you can immediately apply, not just someday, but tomorrow. Thanks again for being part of this community and for the work you do every day to push our profession forward. Now, to officially kick things off, I'm honored to introduce Fullscript CEO and co-founder Kyle Braatz.
Hey everyone, I'm Kyle Braatz, CEO and co-founder of Fullscript. Welcome to Fullscript Forward. To everyone joining us for the first time, and to those coming back, thank you. Whether you're tuning in between patients, or you carved out space to focus on your practice and your purpose, we're glad you're here. Because this isn't just another summit, this is a movement. A community of people reshaping what healthcare can be, and making it better and more accessible for the people who count on it most. Now, I'm not a healthcare provider. I didn't go to med school. I didn't start my career in clinics or hospitals, but I spent the last decade building alongside the people who do. And there's one truth I come back to again and again. Healthcare doesn't change from the top down. It changes because of providers like you. You are the ones moving care from reactive to proactive. You're the one turning patient histories and lab results into life plans. You're the ones guiding patients through the noise with clarity, compassion, and conviction. You're the heroes of this story. And Fullscript, we're here to amplify your impact, to give you tools that feel like superpowers, and just maybe a bit more space to care for your own well-being too. Let's talk about what you're up against. Today's patients are flooded with data, wearables, consumer lab testing, symptom trackers, supplement ads, and of course, ChatGPT. They're searching more than ever, but feeling more overwhelmed too. You've seen it. My hemoglobin A1C is high. What does that mean? Google says I should take berberine. Okay, there's 8 brands of berberine. Which one do I take? Oh, Justin Bieber has a brand called Bieberine? Maybe I'll try that. They're navigating more, but understanding less. They're turning to screen-based care when what they really want and need is a knowledgeable partner, someone like you. But here's the thing. The information overload doesn't stop with patients. It lands on your desk too. Every single day, you're asked to interpret hundreds, sometimes thousands of data points. You're expected to stay current with emerging research, clinical best practices, and ingredient innovation and quality. And all the while, you've got a patient sitting in front of you, waiting for insight, waiting for care. The problem? There's too much information and not enough insight. Let me give you a quick stat from a study out of the University of Iowa. Back in 1950, medical knowledge was estimated to double roughly every 50 years. By 1980, the estimate was every 7 years. And by 2020, the study estimated medical knowledge would double every 73 days. And as it turns out, their prediction may be more than just theoretical. Today, over 1.5 million biomedical research articles are published every year. That's 2 new papers every minute. It's unsustainable. No matter how experienced or brilliant you are, no one can keep pace with that volume of change. And yet, you still show up. You still find the patterns. You still make the calls that help patients live longer, better lives. That's why we believe you deserve better tools. At Fullscript, we're building a platform to support your entire workflow, from capturing patient data, to labs, to treat and follow-up. And we're designing every step to be faster, smarter, and more connected. Because whole person care doesn't happen by accident. It takes structure. It takes consistency. And it takes a platform that works with you, not against you. That's why we launched Labs on Fullscript, to bring diagnostics and personalized plans together in one place. It's why we acquired Rupa Health, to make ordering, testing, and interpretation even easier and more streamlined for both you and your patients. And now, it's why we've built Fullscript Assist, your AI-powered clinical co-pilot. Now, this isn't about automating care. It's about accelerating and enhancing your insight, surfacing the data points that matter, optimizing for safety with interactions and depletions, surfacing the latest evidence, and helping you turn information into action faster than ever. In today's product sessions, from insight to action and streamlining care for better results, you'll get a closer look at how this all comes together. We'll walk through how Fullscript Assist fits into your existing workflow, how it helps surface relevant conditions from lab results, how it offers you evidence-based interventions, how it saves you time without ever replacing your judgment. So you can spend less time sifting through charts and more time making meaningful clinical decisions. These moves support our shared goal of allowing you to deliver your best care in the most efficient and impactful way. We think of it this way: insight equals inspiration plus application. When you're drained, data feels like noise. But when you're connected to your mission, to your peers, to the bigger picture, that's when the dots start connecting. That's when insight appears. Inspiration unlocks insight. But insight only becomes powerful when it's paired with application. The tools, systems, and structure that help you bring your knowledge to life with speed and clarity. That's what Fullscript is here for. To sit at the intersection of inspiration and application. To deliver insights at scale so you can help more patients lead happier, healthier lives. So, how do we help you reach more of the growing number of patients who are actively searching for care like yours? Enter Preventative Journeys. This new service, now in beta, is designed for a real and growing challenge. Patients trying to navigate their health on their own or feeling let down by conventional providers who aren't going deep enough. Preventative Journeys gives you a structured way to engage these patients and bring them into your care. It acts as a front door to your practice, guiding patients through a personalized lab testing and interpretation experience, paired with tailored lifestyle and supplement protocols, all powered by your clinical guidance. It also helps you reconnect with past patients who may have drifted or become inactive, giving them a compelling and low-friction reason to re-engage. For providers, it's a scalable, repeatable way to deliver proactive care without adding hours to your week. And for patients, it's a clear, supported path forward, making sense of their labs, their symptoms, and their goals with the help of someone they trust. This is more than a new feature. This is a new channel for practice growth and a new chapter in whole person care. Let's be honest, the healthcare system wasn't built for this kind of care. But that's never stopped you. You're not here to maintain the status quo, you're here to rewrite it. To shift the system from reactive to proactive, from passive to empowered, from fragmented to whole. You do the hard work, and we're here to build the infrastructure that supports it. So whether you're just starting to explore whole person care or you've been delivering it for years, know this: you are not alone. You are not behind, and you are exactly the kind of provider healthcare needs. At Fullscript, we exist for one reason: to power the people who power whole person care. You are the future of care. You are the reason we build. You are the ones patients trust when they're ready to take control of their health. So thank you for your leadership, your commitment, your courage to do things differently. Let's keep building the future of healthcare together. Let's make healthcare whole.
Thank you so much, Kyle. And welcome once again to everyone who's here with us today. Now we've got an exciting announcement for you.
Hi, I'm Dr. Eric Villegas. I'm one of the clinicians responsible for Fullscript Supplement Quality Program and have over 15 years of experience advising and educating on supplement quality. As healthcare providers, we have to have high standards. In every clinical decision, patient trust is on the line. And as providers know better than anyone, trust is everything in healthcare. I'm honored to have earned providers' trust through the Fullscript Quality Program, and I'm honored to announce that our already strong program is becoming even stronger, setting a standard matched by no one else in our industry. All 375 plus brands in the Fullscript catalog are now required to prove third-party CGMP certification every single year. That means every year, each brand must have proof from an independent company that their products are tested for quality and consistency, that the ingredients in the bottles match what's on the label, that their facilities are clean, well-maintained, and built for clinical reliability. And finally, that they follow every critical manufacturing step for uncompromised quality. No other supplement distributor requires brands to prove every year that their products are good enough for your patients. And though we're committed to raising the bar for supplement quality, we know that quality care doesn't just live on a shelf. While other distributors sell directly to your patients, you and your care are at the center of our business model. A Fullscript account gives you control over your patient's supplement routines, offers a simple way to grow your practice, and delivers in-app education and decision support to save you clinical time. Time you can use to deliver the kind of care your patients deserve without ever questioning quality. Our clinician-led quality program will always ensure the highest possible standards in our catalog, and our platform will always put the provider-patient connection first. So thank you for putting your trust in us. We're committed to earning it time and again with every quality improvement. Because in healthcare, trust isn't given once, it's earned every single day.